invited Dr. Candace Chaney to join us to discuss palliative care and hospice care at end of life with a focus on integrative medicine and complementary health services. Dr. Chaney is an outstanding leader in the field. I don't think it's an exaggeration to say that she has single-handedly been a leader in bringing forth complementary and alternative medicine into palliative and hospice care at end of life. And today we're going to explore these themes and methods with a particular focus on trauma at the end of life and what, as trauma clinicians, we should be aware of and how we can be prepared to really be of effective service to our clients and their families. Dr. Chaney has an illustrious career as a nurse. She is certified in hypnotherapy and in trauma-informed heart math. Not only does she bring decades of clinical experience, but she also brings decades of experience navigating administrative systems, policy changes, and research. Indeed, this is how we met when she agreed to be part of our National Institutes of Health 3-year research project looking at stress, pain, and quality of life in dementia family caregivers. So welcome, Dr. Chaney. I'm so delighted to have this opportunity to talk with you.
Oh, thank you so much. And I just have to say, you're so gracious in the giving me credit for so many things. But as you know, it takes a team. It takes a team around us. It takes so many people carrying that passion forward. So I've just been honored to be a component of that and hopefully help forge the path for others.
I want to discuss a couple of themes today. One is our theme of integrative medicine and complementary approaches. And I know you've got training really with a foot in both worlds, really the foot in the world of very conventional training and how we care for people throughout life, but particularly the challenges at end of life with particularly pain and emotional distress, the use of medications. I also want to look at how these methods that we use and study throughout all of life can be and are being applied at the end of life, and particularly looking at what kinds of traumas emerge both with the family member who may be at the end of life, but also family and caregivers. What particular kinds of music is used for end of life? What could you give a specific example of how music would be applied?
You bet. I think so many people associate harp with end of life because of our Christian culture and harps as well being associated with the angelic realm. But when I wrote the policy, I specifically put in music and sound therapy because there's a power in that drumming of the first chakra there. But, we're moving at end of life, we're moving up through the chakras and releasing that. So the harp and guitar, stringed instruments, the vibration is just so felt and so beautiful. And it works in a way that even when your cognitive abilities are declining, your subconscious, you are picking that up. You're feeling it in your heart. You're feeling it in other areas. The other thing that's beautiful about music is it uses different pathways in the brain. So we will see people with dementia who have lost speaking ability suddenly start speaking.
We're creating a stage for vibrational communication. We're not saying that words are the most important means of communication at this stage, but touch, sound, vibration are other modalities by which to connect and communicate.
Yes. We utilize healing touch, therapeutic touch, and Reiki. Again, not because of they're better than any other. It is just some modalities that we have some standardizations and have been able to start using. Also cranial sacral. I don't have a polarity therapy provider with our company yet. So, hey, yeah, and but what those modalities do, as you know, is it's working with the energy field. And while often people will ask for massage, I love it when I've got a massage practitioner who knows also the energetic field and has studied that as well. Because there comes a point as we're moving out of our physical body that the tactile, the touch needs to be very energetic, very calm, very, if we're doing massage for rehabilitation, which I've had some therapists come and they will start wanting to do range of motion because they think, hey, we're losing that by being in bed. That's what we need to do. That may not be what's appropriate at this moment. And that is it anchors somebody back in the physical body as they are doing the work of leaving.
And what is your experience, Dr. Chaney, with the use of cannabis, for example, for end-of-life anxiety or discomfort? I know that you live and work in a cannabis legal state, and I'm wondering, I'm curious in large part because there's been some research, not necessarily focused on end of life, but suggesting that with the legalization of cannabis, we've seen a reduction in some of the opiate overdoses in the states where people have access to cannabis. And I'm wondering what the status is and whether you've seen efficacy. I think that's the more important question.
Definitely. It helps a lot with nausea is one thing, because that is as our body shuts down, often it's our GI tract that is shutting down as well. And food, if we're still trying to keep eating food, or we've got family members who associate you eating with love and caring, it's really hard for it when the patient isn't eating. And so sometimes they will eat, but cannabis can help with any nausea that may happen with that. Also, with overall body pain in general, it can really help a lot. I mean, we're all seeing how much, the CBD oil, let alone utilizing cannabis, helps with the body pains and symptoms of things.